line. We've got a lot of folks on here, so we'll try to leave plenty of time for questions as we go through the content today. My name is Beth Rouse. I'm with the University of Kentucky, and I'm joined by several of my presenters around the country, all of us here to talk a little bit about collaboration in care and education and give some guidance to those of you in states who are working in collaborative partnerships. The materials for this meeting are on the Research Connections site. You should see that on your screen. So if you haven't had a chance to download those, please take time to do that. In Research Connections, you'll see a box that says Collaborative Projects, and that's where the handout is. What I want to do is start the webinar with just a little bit of information of how we came to the point of having this webinar. Last spring, May of 2010, there was a roundtable that was held in partnership with the Office of Research Planning and Evaluation, Office of Child Care, our U.S. Department of Education, Early Childhood folks, and Head Start, to look at how do we begin to think about collaborations in terms of research and evaluation. We know we've been collaborating for a long time, but we wanted to be able to say, what do we know about effective collaboration at the state level, at the local level in early education programs, our child care, Head Start, pre-K, and then what do we know about the process of collaborating, what makes it work, what helps us in terms of promoting collaboration across these sectors. So we asked some broad questions in this roundtable with a group of researchers related to what do we know, what do we need to know, and what are some of the approaches that we could take to further research and evaluate collaboration in the field. What are some issues around measurement and design that we need to consider? And how do we use this research to help us both identify where it's happening well and what about it is working, and then for whom are these collaborations working? As you all know, across the country, we've really been working over the past couple years to increase the collaboration that happens across the sectors in early care and education. And the Early Childhood Advisory Councils are an example of how the federal government is supporting us in putting these collaborations in place. So we know that we have an increased emphasis, and we also know that we have a high need for collaborative leaders, or those leaders who are able to pull together groups to help with shared responsibility and mutual accountability towards common goals. We also know that there are some key aspects to collaborative leadership that tend to make a difference. And
entry and exit chimes are off.
And having trust among your members, being able to be committed individually, but also understanding our organizational purposes, and then having some shared vision around what we want to accomplish, and that vision being supported through our actions, experiences within a group. But the reality, for those of us that have been doing this for quite a while, is that we have constant changes in our leadership roles, both at the state level and the local level. So we need to build relationships again and again and again as people change. But we also know that we find it much easier to work with people who are closely aligned with us in terms of their own philosophy and our areas of interest. So what we have to do is figure out how do we work around those things and these changes to make collaboration work for kids and families. We also know that when we build strong relationships collaboratively, that it can take a toll, human toll and physical toll. So it takes a long time to build those relationships. We know they do make a difference, but we also know that they're very easy to disrupt. So a change in our program focus, a change in policy, or a change in people can really disrupt collaborative relationships that we've spent a long time building. So as we think about the content today and what we're going to learn, I'll offer some what I call gears and levers in terms of thinking about collaboration in our field. And if you start on the far right-hand side, we do know that the more agencies that we have to bring around the table, the more will and energy we have to put into that, and the more focus and knowledge that we need from our leaders. We know that leadership change makes a difference, and our collaborative history and approach can be disrupted when we have change in leadership, and that also changes the relationships and the dynamics of the groups. We have learned lately as well that when we have resources and federal or state initiatives that come into place, sometimes these can take away from our collaborative partnerships as leaders have to focus on their own internal programs and new initiatives, monitoring, or new programs that are coming through. And that disrupts at times our collaborative energy. So what we're going to do is we're going to spend a little time talking about a logic model that's been developed that came out of the roundtable from last spring. And we're going to talk a little bit about one state's efforts in Maryland to build a system for early childhood based on collaboration. And then we're going to talk a little bit about a local effort and what that looked like in terms of collaborative data system development. If you have questions as we go along that are clarifying, you couldn't hear, you need someone to go back a slide or repeat, if you could please just go ahead and use your chat box, and I'll try to redirect our presenters to go back and answer that at the end of their presentation. But we'd like to hold most of the questions and comments until all three presenters are done. I'll be trying to keep them on track in terms of the time that we've devoted to each one. We are going to have to switch off slides, so that'll take just a second as we get going. But I will introduce you now to Jessica, who's going to talk to us a little bit about the logic model that came out of the meeting and present that to you in a way that we hope can help you with your own collaborative relationships. So Jessica, turn it over to you.
Jessica, you might be on mute. We can't hear you.
Hear me now?
Yes. Thanks,
Sorry.
Jessica. That's okay. I'm sure everything you said was wonderful, but can you start again?
It was shockingly brilliant. I'm sorry that it wasn't there. To start us off, I just want to briefly touch upon the purposes of the logic model and highlight some of the assumptions behind this model. Logic models are a really great way of organizing your understanding of how something works and how various factors and influences may result in some form of outcome. Most of you probably have some experience in creating logic models, even if you don't really think of them this way. You know, it's really thinking about, if we do X, would we anticipate that it would lead to Y? The logic models really make evident the different activities, outcomes, and theories embedded in some kind of examined activity. So when we're thinking about the logic models as applied to state-level collaborations for children, it's really a theory of change model. For those of you who are familiar with the Kellogg Foundation logic model types, there are several different types. And the theory of change model really looks at the theory of change that's embedded in a program that structures the design of the program and should lead to particular outcomes. So these models really help you illustrate how and why you think a program should work. So this logic model, again, is really highlighting the factors that we think will contribute to effective collaborative efforts at the state level and how those collaborative efforts should contribute to outcomes at different levels, including the community and family level. So we're considering a logic model for evaluating state-level collaborations. There are a couple underlying assumptions that need to be explicated before we move into looking at the logic model itself. So first of all, the primary actors involved in a state-level collaboration are policy-level agencies, those charged with making policy about a set of services, providing resources to fund those services. So these actors will consistently be referred to as stakeholders throughout the model. The stakeholders do need to send a designated agent, so the agency has to send somebody to participate in the collaborative efforts. But it's really the agency as a whole that's the stakeholder in the collaboration. Then when we move down to the lower levels, we're going to then involve service delivery actors. Also, too, when we're examining how the inputs into collaboration are converted into a collaborative process, we're really looking at the quality of the collaborative process, how that process operated, and whether or not the stakeholders found it to be of high quality. Well, outcomes are important, and obviously we all get into these kind of endeavors to produce some kind of positive outcome. Effective collaboration is as much about how you do the collaborating as it is what's produced from the collaboration. So effective collaborative processes can become social and political capital for those involved, paving the way for more and better collaborations in the future. Many of us have been involved in collaborative efforts where we really know we probably would not want to work with those people ever again. And that's a result of not having a quality process. And the more you work together and the quality of that working together can lead to better collaborations in the future. In terms of the outcomes that we're thinking about, we are concerned with the quality of the process, but we also want to think about, we view this kind of a collaboration at the state level as being effective if it produces certain desired outcomes, which we're going to look at on the next slide as the components C, D, and E. So a logic model designed for state-level collaborations should be a general model, because there are going to be many different examples, and we're going to talk through some and sort of think through hypothetically how you could apply this to different contexts. But basically, you need to think about how context is going to matter in implementing a state-level collaboration. Demographics, social and economic factors, politics, the resources you have available, history of past efforts of collaboration or reform are all going to affect your ability to execute a new collaborative effort. Okay, so now I want to walk through with you all the different components of the logic model and then explain some of the components and some of the possible ways to measure these components. So hopefully everybody's still with me. Okay, now everyone should be seeing the slide on the logic model. So when we start walking through this logic model, the first step really are the inputs to collaboration. These are really what you have to bring to the table to design an effective collaboration. This is really the construction part of the collaborative effort. So these inputs really focus on the internal design features to the initial collaboration and what the stakeholders need to bring to the table for that collaboration to get established effectively. So the A column is really about how you're going to structure your collaborative activities. What's the goal of the collaboration? What do the different parties coming together bring to the table? So some of the different variables in this initial piece, the A, the inputs to collaboration, include first the stakeholder inputs. And these really cover what are required by each stakeholder joining the collaboration in order for participation to be meaningful, in order to promote effective work in the collaboration. This can include things like organizational time and resource commitment. So all of us have been involved in collaboration where that activity is an add-on to our already very busy schedules. You have to have a secure commitment of time and resources to the collaboration. You also need to send a powerful agent, someone who actually has the authority to speak on the behalf of the stakeholder organization. And you also need to think about what is the level of commitment to the collaborative mission. Do people buy into it and do they take ownership? Then we have the actual design components tied to the collaboration itself. Do you have the right number of people at the table? And is it an appropriate number to get the work done? We all know the adage, too many cooks can spoil the soup. So we need to both have the correct number and correct representation of stakeholders. Also, how clear are the decision-making rules? Really setting up rules about how we're going to make decisions, how those decisions are recorded early on is going to help facilitate the process. We also want to clearly delineate roles and responsibilities. Make sure that people know what they're going to be doing. And those roles can include such key roles as a manager, who's going to provide administrative support to the collaboration, take notes, take minutes, make sure that they record the decisions made. Who's going to facilitate the process? Facilitation includes such activities as, making sure that processes run smoothly, encouraging discussion, allowing stakeholders time to participate. Then we also want to have an entrepreneur who's really championing the effort, who keeps the collaborative effort going when things start to get tough. So when we think of the first, again, the inputs to collaboration, it's really about what do the different stakeholders bring to the table in terms of resources and commitment. And also, have you set up the collaboration in a way that's going to be clear for everyone and really set forward a good path for moving forward and taking those inputs and converting them into a process. So when we move into the next step, the process components, this part of the logic model really looks at the generative design of the collaboration, how initial design structures are really converted into working routines to do the collaborative business. So all of us have been involved in collaborations where the best laid plans of mice and men. We all have really good intentions at the outset, but how those intentions turn into a process maybe isn't very effective. So the process components in some ways are outcomes of the initial design process, but they also structure the collaborative effort moving forward. So process components are outcomes of the inputs, but they're also activities driving forward the future collaborative outcomes. So in terms of some of the different process components, we can start with first norms, the ground rules that shape how the stakeholders interact. Now, these aren't the decision rules, but more rules about how you're going to keep the process operating appropriately, how people are recognized, who gets the floor, rules about, how many times people can speak in a meeting before everyone else has participation. Also inclusion. Do stakeholders perceive that the parties who need to be at the table are present, with a wide variety of viewpoints and interests represented? For a collaboration to be viewed as legitimate, you really want to make sure that the appropriate people are at the table. If there's if you're putting together a state-level collaboration between Head Start, child care, and pre-K, and the Head Start representative isn't there, and that's going to challenge the quality of that process. You're going to view, obviously, that somebody's not at the table. Also, authenticity. Do stakeholders perceive that the collaboration has the authority to make binding decisions? Or is it simply legitimating already made decisions? You want to really view this as being set up to really do collaborative business, not to simply legitimate or sign off on predetermined decisions. Quality, how well do people at the table feel that they have an equal opportunity to influence the decision process? Problem focus. Do the participants view the collaboration as really trying to get at the root of the problem? Many of us, sadly, have been involved in collaborations that maybe were put together because it's politically necessary or it's a good way of sort of demonstrating action. But if there's not a clear representation that you're going to be trying to solve a legitimate problem, that can weaken the quality of the process. Again, support. Do you have the appropriate support to do what you need to do? Okay. Ooh, wow, I've been talking for a while. I just got a little warning. So I'm going to move on quickly. In terms of just really to finish up the process components, generative purpose. This is really how stakeholders come to understand the purpose of the collaboration. Many of you have been involved in a collaboration where perhaps you were mandated to be involved in that. However, if you can, through the process, reshape that why you've come to the table, it can create a better quality process moving forward. Okay, so when we move to the collaborative outcomes, these are really going to vary depending on the nature of your collaboration. It can include things like changing understandings of the policy problem. In many policy fields, you have different policy designs, different institutional structures, bringing people together and creating shared problem definitions of what you're seeking to do, reducing fragmentation, improving relationships and trust, increase collaborative activity. Again, the more you work together, the more and it's a positive activity, the more you may work together more in the future. Increase political will, coming together, creating this shared problem definition and trying to solve a problem can really quite often get people inspired to continue working towards this. And also how that collaboration may affect the stakeholders, the key stakeholder organizations. Do you go back to your organization and do the work differently? Now, if we look at the service level and the child and family outcomes level, again, these are going to vary depending on the nature of your collaborative activity. It could be at the service level, improving professionalism, improving professional knowledge, quality of services, consistency, creating better lines of communication between the state level and the service delivery level. And again, at the family and child level, it's going to depend on the nature of the particular services, but it really is going to be focused on, improving outcomes, improving well-being, but also improving the ability maybe to track those outcomes over time. Okay, I'm almost out of time, so I just want to sort of bring it all together. And what we need to think about is how this would work in practice. when we think about an example, say you wanted to create a state-level collaboration to improve family and health services in early care and education settings, you would need to think through, okay, who do we need to bring to the table across the state level? How are we going to set ground rules for the process? And then also, how is that going to translate to the local level? Finally, we want to think about, this logic model was designed for research purposes, but it could be easily tailored for evaluation purposes. And one of the components is that you could pull out different pieces of this and really unpack, certain key components depending on what you want to look at. So if you're really looking at, okay, we've brought people together at the state level, we want to know if that's improved communication between different state agencies. We could focus on A, B, and C. Or if we want to look at the state-level collaboration has been running for a while, how is that filtering down to the bottom level? We could look at C to D. So again, there are many ways to kind of pull out different pieces of this and measure different components. And this is still a work in progress, and it needs to be applied to an actual collaboration in practice to really fully explicate the connections between the components. So, and I think actually the presentations coming up are nicely touching on some of the components in the logic model, so I think it should help unpack some of these in practice. So I think I'm just about out of time, so I'm going to pass it back to Beth, and I thank you for listening to me.
Thanks, Jessica. What we're going to do now is I want to remind you all that if you have questions, feel free to use the chat box as well as the question box, and we're trying to get to those questions as we can, especially the technical questions. I'm going to turn it over to Rolf, who's going to spend a little time talking with us about the Maryland efforts around their early childhood system and collaboration. So, Rolf.
Yeah, good afternoon. I wanted to talk to you a little bit about Maryland as a state and talk about some of the current developments in Maryland in terms of collaboration. And I'm picking up on Jessica's logic model framework and described collaboration as work being done, if you will, at the table with all the partners and as a way of doing business. I'm going to offer you two contexts that are very important to remember in terms of collaboration. The first context is the fact as to how early care and education is being structured in our state, meaning that it is within one agency, the Department of Education, since 2005, and the collaboration aspect with respect to a consolidated system of early care and education is then sort of reframed of collaboration within an agency and the mandate and the mission of that particular agency. And I'm going to go into that in detail. The second context is within our State Early Childhood Advisory Council, which provides the overarching early education policy with respect to a number of outcomes that we're looking for young children that encompass a number of agencies. Within that context, the second context is our Children's Cabinet, which is a cabinet of all child-serving agencies in Maryland, and this council is the Early Childhood Subcommittee for that Children's Cabinet. So there is a structure for early care and education, and early care and education is also structured within the context of child-serving agencies. The first context, and I'm picking up on some of the process components that we have heard about in Jessica's presentation. The norms that we see in collaboration are really defined by the state agency within the executive branch, in this case the Department of Education. And so the ground rules that we're working with as the way of doing business is really defined by legislative mandates, the regulations that we'll have in place for certain programs and or initiatives, and then our mission and policies. And we have, after the consolidation, made sure that we have our own division mission. That means that there's a overarching mission for early care and education in our state, and that policies are driven by that, by the mission. Then the second aspect, and the norms of collaboration defined by the state agencies, is really changing. And the tools and levers that we have, to a great extent, is the process by which legislation is made, in other words, bills or any kind of legislative initiative, and how we define regulations. So we have quite a bit of authority in changing the various aspects of the work that we do as a result of the collaboration within the department, and then in the second context among the agencies. The second point that I wanted to raise is the facilitation. That means, how are we going to bring the components of inclusion, equality, and authenticity into focus? That means, how are we making sure that all various aspects of the work and the mission of our department is being touched on? So, for instance, it's very important that within our division, the collaboration is facilitated through an internal mechanism, and so the interdepartmental committees and work groups and other processes that really help us to not only to develop policies, but also have procedures in place for local jurisdictions to implement specific initiatives that we want to put in place. For instance, under special education, it was very important to us to do inclusive childcare, that children with disabilities have access to childcare programs, that they are not being denied access by the mere fact of their disability. And that was an issue that we had to deal with when we had the consolidation underway in 2005, and through a collaborative effort with our Division of Special Education and our Attorney General's office, we were able to really establish some work groups and other processes that helped that along. We have a hunger initiative in Maryland, so that young children in our early childhood programs really have a tie-in to our food and nutrition program. All of this is housed within our department, so the collaboration with that unit is extremely important. And again, there are certain aspects in terms of authenticity, that component that Jessica was talking about. Is important that there are particular units that have the authority to make decisions about particular programs and services that would help us in that process of interdepartmental collaboration. Problem focus, that is very has been a long-standing goal in Maryland, to have early childhood education linked to K-12 education and school readiness or readiness to learn, and early learning opportunities gap, which means sort of the counterpoint to the achievement gap in K-12, is something that we focus on, and that is the problem that we all seem to rally around and make it work. So a lot of what we do drives the accountability and the strategic planning process to see what particular services, what particular programs and initiatives are enhancing the early learning opportunities for young children and improve the school readiness skills in our young children. And then the fourth aspect I wanted to bring out as one of the components in the logic model is support. Having a consolidated process really enhances collaboration, because you have the agency infrastructure in place, a budgeting and the joint budgeting process in place, and the joint enforcement authority in place to address issues within the early care and education system. In terms of the budgeting process, our state was very keen on having a children's budget in place very early on. That was more than 10 years ago. That means in this particular case that our division within the department has its own budget hearing process, and therefore a way to really air some of these issues that we consider to be important and the thriving school readiness goals in Maryland need to be addressed through the budgeting process, even at the time of budget containment that we experience right now. The second context is a little more complex and probably is more applicable to a number of states because early care and education systems are typically arranged within 2 or 3 agencies, and then it filters down to the local level also with different partners. The norms of collaboration on this second, the second context really relate to the governor's agenda. Governor, obviously overseeing all these child-serving agencies, has an interest to make sure that the Health Department, the Department of Human Resources, the Department of Education, and the Department of Juvenile Services are in sync with respect to the work done for young children. And the governor develops an agenda, it's part of the legislative agenda in the governor's office, and therefore a lot of the collaboration takes place as interest-based negotiations, meaning that particular priorities are being emphasized either for 1 year or for a number of years, and those are then being picked up by the legislature and being processed. For instance, we have result areas in Maryland that drive policy development within our agencies, child-serving agencies, and so we had, aside from children entering school ready to learn, we had other areas that the legislature and the governor's office are looking for, the children born healthy and healthy children. Also, of course, affects young children, and those kind of areas are then part of the priorities that are being worked on as part of the collaboration within our council. The facilitation takes place within the Early Childhood Advisory Council. We have had that in place for about 12 years and just recently received the funds, recently, maybe 10 months ago, received funds from the federal government to implement our most recent strategic plan. And then these recommendations then flow into the Children's Cabinet to create policy within the governor's office. The problem focus is the same that we have within the agency, the Department of Education, which is school readiness, although there is a strong component of healthy children being worked in, especially as it comes to mental health issues for young children, and of course the basic support of health services through our Maryland health service programs is part of the focus that we exercise at the Early Childhood Advisory Council level. The support is that the multi-agency approach is available, joint funding, and that our legislative committees are working on this. Give you an example. If our council has any interest in promoting any any legislation, any bill that needs to be introduced, passed, and adopted by the governor, we have a joint committee on children, youth, and families that will do that for us. So in that way, we have a strong collaboration between the executive branch and the legislative branch on these issues of early care and education. The outcomes that we have really transcended the issue about how we prioritize our problem issues. With the shared focus, again, is on school readiness and early childhood education in alignment with K-12. When I talk about fragmentation, I mean a reduction in fragmentation in Maryland, a more streamlined decision-making process within Context 1 and in Context 2, and then having a stronger overlapping of missions among the agencies as a result of that continued collaboration. Because we've been doing this for years, there's improved relationship and trust, and long-term engagement, and we had long-term leadership. This PowerPoint was written before our state superintendent, who was a champion in early childhood education, just announced the retirement this summer. So I think we're going to go into a phase of some transition and change, and it's going to be interesting. There's increased collaborative activity. In other words, everybody's just a phone call away or an email message away to make sure that some aspects of our collaborative initiatives are being followed through on, and that certain things are done. That includes joint funding, division of labor, and some local collaboration models that we've put in place. Inclusive childcare, for instance, or partnerships that we see in early childhood education between early childhood programs and the public schools. There, however, are a number of issues that still are in play and really need to be addressed. By having a fairly advanced way of collaboration, it is important to maintain transparency among all partners. A lot of information needs to be disseminated through a number of pathways so that not only our state partners but also our local partners are in tune as to what's happening. The more tricky issue has to do with the collaboration between, for instance, our state board of education and the local board of education as it relates to early childhood education. As at the state level, early childhood is part of the education mandate, that's not necessarily the case at our local jurisdictions. And so there are still issues that need to be resolved in terms of collaboration between our early childhood programs and the local school systems. And then we also have issues with respect to federal policies, with respect to programs that bypass the state and the authority and therefore become a different level of collaboration. In particular, any federal program that's directly overseen by the federal government to the local level. Still something that we have experienced requires an overcoming of some kind of barriers that we have seen, and the framework that we have with this first context and the second context in particular helps us to address these issues.
Wonderful.
Thank you.
Thank you, Rob. I appreciate that. I'm now going to turn it over to Heather. No relation to me, even though our names are similar. And Heather's going to talk a little bit about the work that's been happening in Philadelphia. Turn it over to you, Heather.
Okay, thank you. I want to make sure everyone can hear me and they can see my slide. So what I'm going to talk about today in my brief 10 to 15 minutes here is an example at the local level. So in the city of Philadelphia, of how folks have come together to really create a collaboration process. And this has been going on for at least the last 10 years. We've been looking to set this up. So the Kids Integrated Data System is what I'm going to be talking about. And what this is basically a system for the integration of administrative records across all different systems that serve children and youth. And what it does is it provides individual and aggregate geographic information-based information for policy analysis, strategic planning, research purposes. It was really designed as a partnership effort between university researchers, the local public service providers in the city and the school district of Philadelphia, and the local William Penn Foundation. And the reason why this is important is because from the very beginning, folks did not want to create something sort of outside of the collaboration context, so that this was very much building from the ground up of we want to create a process by which we can have regular, routine types of information about the children and families that we're serving here in Philadelphia. So the real focus of it, and this came out of a one-time school readiness study that occurred in 1997, then Mayor Rendell. And basically the result of that was folks were very excited about the ability to take a look at an entire population of kids coming into school and be able to look at all their different experiences. Did they have Head Start? Did they, were they involved in the child welfare system? Have they ever had a homeless experience? What are all the significant needs in places where young children have touched other public service systems before they get into school? So the focus of the collaboration initially started around school readiness, but the idea was that folks wanted to create a sustainable infrastructure that was cross-system and that was policy-driven. So those were really their end goals. It was policy-driven to be able to create good evidence that our local district and city partners could use to make decisions. This is a list of some of the folks that have been involved and are currently still involved, and you can see this represents both across human services, also public education. Basically, this was a tale of two realities. I think most folks here on the call are coming from the sort of government policy and practice side, and sometimes we speak very different languages. I come from the academic research side. And so thinking about how we created a collaboration where we could actually talk to one another was very important. In government, you say, oh, you need a data infrastructure. What's your research mission? What's your capacity for longitudinal cross systems, blah, blah, blah. And folks kind of look at me like I have three heads. Well, same thing goes in research. You think about how long it takes to develop partnerships and the fact that a lot of times folks need answers now. They need answers yesterday. To policy questions or to questions about their populations. And so bringing these two realities together and really trying to think about how could we have an effective collaboration that essentially creates a capacity for us to do things. We didn't want an it that's going to solve all of our problems in, let's say, school readiness, but we wanted to create something that would allow us the flexibility to study the important issues around school readiness as they came up. So the idea was to think about building on existing capacities within administrative systems. So we look to the administrative databases that all folks are collecting now, health systems, child welfare systems, the state longitudinal data systems in education, early childhood systems. There's already a process within each of these systems to collect information. There's already an infrastructure that exists. Social workers are trained in how to interview families. Teachers are trained in how to collect assessments from children. All of this different information can be used to inform different decisions at multiple levels because this is the very information that the systems are collecting already. It's not something in addition to what they're already doing. These data can also be used to build comprehensive models that help us understand how the different systems interact with one another and help stimulate strategic planning, help stimulate ideas about how agencies can work better together, and really creating a dialogue across these agencies who are essentially serving the same populations of children just in a different context. And lastly, really thinking about how this information can be used in sort of a community awareness kind of framework to really support the notion of community-wide action and focus around a particular idea. So what KIDS did, the KIDS Integrated Data System, was really help us create a common language for how we can work together. And this has been a constant negotiation. So I'm going to talk through a little bit about some of the steps that we went through and some of the processes that we've developed to enable us to continue to work on this collaboration over time. Because we have gone through 3 different mayors, we've had 4 school district superintendents, all of our commissioners of social services have changed, so we've had to go through lots of different leadership. But what was important was that we had a process in place that would enable different changes in leadership, new needs with respect to policy and practice, or whatever may arise over the last decade. So basically, I like this visual of a pyramid because it really makes you think about the importance of the foundation, and that if our ultimate goal is at the top, right, we want to improve services, we want to do better for young kids and families. But we can't just start there. We can't just say, oh, we need the answer. We really have to start with a foundation of collaboration. And I'm going to walk through how each of these steps enabled us to build this KIDS Integrated Data System here in Philadelphia. So the first step being about collaboration. How do you collaborate? What does that mean? With respect to data, we're talking about creating the legal and ethical agreements to combine individual data from these multiple agencies that will meet the needs of each of the independent agencies. So this is all about coming together to try to think about what is it that we really want, what is our common agenda, and how can we ethically create procedures that will allow us to get there. The second step was really bringing the science in. which was thinking scientifically about how you take all of these separate, disparate systems and bring them together in a scientific way where we can actually know what the data mean. Every different system collects a variable, let's say, on race or ethnicity, but we may all collect it very differently. So we needed to bring a science to that so that when I say race, ethnicity, you know the categories that I'm talking about because we all have similar categories of how we're thinking about this. And also scientific processes in matching data. So for us, it was very important of how we understand all the different source systems and how they identify children and families in their databases so that we could create, and this is where the nerd in me comes out, where we could create models to match these records so that we could have a longitudinal look at entire populations of children and families to really be able to study some phenomena that are going on within the population. The third step was to demonstrate, was to use this system. So we had to create some of the procedures, we had to bring the science to it, and then we really had to show its utility. So this is, again, back to the ethics of creating a data system. Typical, unfortunately, I'm part of the research community, and I know that there's a lot of times when you see research being done and it sits on a shelf once it's done in the library and no one uses it. This was something completely counter to what we wanted to build here in Philadelphia, and every piece of research we wanted coming out of this. Even the calls for researchers to come work with us really was driven by the needs of the city and the school district. So we picked 3 important areas at the time that folks had identified. One was around child welfare, one was around homelessness, and one was around early childhood. And we commissioned 3 small evaluation type studies where we used these administrative data to really demonstrate the value of it for our policymakers. The next step was to share, was to really work with our stakeholders and policymakers on establishing networks to talk about not only what we've found, but then what's next. Obviously, as soon as you answer one question, there's 9 more that folks want to know. So how we kept that process going and created a place where it was safe to ask questions of the findings and the data. And then really working to think about collaboratively, how can we improve policy and practice, and also improve the data within these individual systems. There were times when our partners would say to us that they want to know something about their families who are in, let's say, for example, in the prison system. They want to know more about children who have incarcerated parents, and how can they find out more about the impact on that, on children. Well, we find out that in the data system, they don't actually collect any information about who the families are. It's just the individual adults. Well, then we can work with you to create a way to capture those things so that we can then look to study that in the future. So it's really been a back and forth process, and it's been really neat to see how some of these things play out. I'm going to skip over these next couple slides relatively quickly, but these just kind of give you a flavor for some of the different issues that we had to discuss in going through this process. So the first one was talking about legal issues. There's a number of privacy regulations, obviously, that folks we had to adhere to. And this is one of the important things. We had to take a look and pore through the Health Insurance Portability and Accountability Act, the Family Education Rights and Privacy Act, which you all are probably a little bit more familiar with. But 2 of the things that really came out of this sort of study was that each of these said there were clear requirements for how data can be used in these systems. One was that in order to be used for research, it had to also be practical. So the research had to be practical, and there also had to be clear, straight security standards and protocol for how the data were used. The ethical issues were really all around sort of the fears and concerns between all of our different camps and what that means with respect to control of the information, being willing to give that over to a common place so that we can all work together in trying to understand the data. But here's some of the things that that came out of our discussions with some of our folks at the city and the school district. What we came up with was basically that we needed to establish a governing board, a governing council that would help us monitor all of the things that happen with this data system and really direct all of the work. So this policy group that we established is a place where each agency elected a representative, where all proposals for research and use of the data were reviewed, created requirements with any researchers who were provided access to the data about how they can use the data and what they can do with it, all de-identified, by the way. And the researcher is required to stay in contact with the policymakers. So it's not, researchers want data sets and often, they might just go away and do the research and publish it and whatnot. Well, there are requirements with respect to the researcher having to stay at the table and talk with the policymakers as they are doing the research and answer new questions that may come up and stay involved in the process throughout. The scientific integration process really, we wanted to try to figure out a way to have the least amount of burden on the source system. So we created a process that basically said dump what you have, in whatever format it is, and we'll bring the science to that. We'll create the science out of those dumps in whatever format, if it's Excel, if it's a text file, if it's an Access database, whatever folks had. And we would create a system for creating, quote-unquote, research-ready data. The KIDS policy group is going to monitor approvals. The data sets were all integrated on a project-by-project basis once things were approved. And then these data were shared with researchers so they could conduct the research that the policymakers were asking for. Just to give you sort of a flavor, a sample of, and this would be, I guess, some of the products or some of the outcomes that have come out of this collaboration, these are the types of questions that we can answer, the types of policy questions that we could take a look at. So how do multiple risk factors impact school readiness, or what risk factors impact school readiness? What's the overlap between special education and community health? How are education outcomes affected by other system involvement, affected by, say, children who are involved in child welfare or the homeless shelters? So you can here kind of get a sense of the different types of questions. And sometimes, one system, the research was more relevant to one system than another, but there was really the sense that, folks needed to be involved in the give and take, knowing that, one of these projects or some of that, they are going to get some of their needs met, but they may also need to be willing to participate in another study that might not be of primary importance to them, but they could see why it's valuable to another system, so they'd be willing to participate. And lastly, we've really had a great response with respect to actual things changing within the local policy arena. So we've been able to build different capacities. There's now a standard kindergarten interview process that happens with every family coming into kindergarten to understand some of the experiences of kids coming in. Through the data, we were able to demonstrate the need for a clearer training academy for teachers and principals for kids moving from Head Start or pre-K into kindergarten. Identified kids underserved by early childhood education. And the mayor actually commissioned a task force, a Latino task force, as one of the populations of kids that was being underserved here in the city. Put together a task force to really try to figure out how do we address this. Now that we have these data that show us definitely, these kids are not accessing this care as much as the other kids, how do we do that? And a number of other things, and this is still, an ongoing process. But I'm going to close here. I wanted to just really give you a flavor of what the Kids Integrated Data System was all about and the different procedures and things that we set up. But it really was a process. It really was a setting up of a system rather than a static type of a product. So at this time, I'm going to turn it back over to Dr. Rouse, who's going to lead us through some questions and discussion.
Fabulous. Thank you, Heather, and thanks to all of our panelists for your presentations and insights. They're very interesting. I want to give you an opportunity to ask your questions. There are a couple ways that you can do that. You can post those in the chat. You could also post it under the question. Some of you already done that. Or you can raise your hand and unmute and actually ask your question so that we can hear your voice. I'm going to start us off, as you all are thinking about your questions, with one question that was raised related to the participation of the System of Care grants in some of the efforts that we're doing, and how are they included and what are they included in. So I'm going to turn that question over to Kathleen from the Office of Research Planning and Evaluation so she can field that question for us. Kathleen?
Hi, thank you. This is Kathleen Dwyer at ACF, and I actually have a two-part response to this question. And first, I just wanted to clarify why this, can you hear me? I hope so. Okay. So I wanted to clarify why this webinar is largely focused on child care, Head Start, and pre-K collaborations. And this goes back to the roundtable that was held in May 2010 that Beth had mentioned at the beginning of this webinar. And that roundtable focused on research regarding collaborations, and the topic is so large we needed to focus. We had to set parameters for the discussion, and that was why we focused that roundtable on the studying, measuring, evaluating the process of collaborating at the state level and specifically within or across child care, Head Start, and pre-K. And then this webinar followed from that original roundtable. We wanted to be able to share some of what we learned at that meeting with a broader audience. But that's why there is this focus, and that is probably the only reason why. And I guess my second part of my response is that I just want to acknowledge and note I appreciate the feedback that clearly some more collaboration is needed at the federal level between the different systems and including maternal and child health. So I just wanted to acknowledge that feedback. So thank you.
Thank you, Kathleen. We have other questions. We did have one question about whether you're going to receive the PowerPoints. You should already have the PowerPoint and the information, but all of those are going to be posted on, or are posted on Research Connections on the site there under Collaborative Projects. So you should be able to get that information at that point.
Well, yeah, this we can post the slides from this presentation on Research Connections, and also the webinar is being recorded and will be made available on Research Connections also.
Great. And then, Heather, we have a question for you in terms of whether there are plans in Pennsylvania to expand the data collaborative decision-making approach to the entire state.
Yes, no, that's a really good question. There's actually a lot of different discussions going on, both at the state level and the national level. And if folks are interested, there's actually a national network right now that was recently funded by the MacArthur Foundation. Two co-founders, John Fantuzzo and Dennis Culhane, that I mentioned earlier in the presentation. And they have put together actually a sample of about 8 to 10 different sites all over the country who are doing different types of decision-making and data-based approaches. So there's some at the state level, some are more at the local level like ours. But yeah, we're definitely in discussion about how this model might be expanded. A lot of what we're finding out in this network is that really trying to figure out the purpose, the goal of the collaboration really drives how the data system and the processes are made. So it may not necessarily be directly transferable from local straight up to state. We may need to rethink how we will put in place some of those procedures. So that's a very good question. But we do have, if you would like to go on that MacArthur Network website that I just mentioned, it's if you search Intelligence for Social Policy at the University of Pennsylvania. There'll be some more information about that.
Great. Thank you, Heather. I had another question. I apologize. Some of you apparently, I was speaking very lightly, which is unusual for me, for those of you who know me at the beginning. And there was a question about whether I had offered some additional resources. I did provide some citations, and those are in the PowerPoint, which will be posted. But if anyone has any questions, feel free to email me directly. You should have my contact information. So, Jessica, I think you have a question for Rolf.
Sure. Can you hear me?
Yes.
Great. I was actually just struck by his comment that the superintendent, who had been very supportive, was going to be retiring. And I think, sort of question and comment, sort of knowing that a key leader or key collaborative entrepreneur may be cycling out of the structure, what do you think would be some useful steps to try to kind of shore up the support in preparation for that? And I also think it would be really interesting to document, how that might change things in the future. So comment and question. So what do you do to prepare for when a collaborative leader moves out of the structure?
That's a very good question, because we'll probably have to, sit down and think about this a little bit. I mean, just off the cuff, there are some things that are going to be in place, hopefully for the successor, and that is our state superintendent was the chair of our Early Childhood Advisory Council. This is a governor's council for a strategic planning process in early county education. So hopefully the successor will take on that role, and that. But in order to make this work as a way to get the new leadership involved in early childhood education, especially being behind the consolidation that we put in place 6 years ago and feeling comfortable with that, it requires some, long-term conversations and, of course, ways to introduce the successor into the field. I mean, a number of forums that we might have, or involve the new superintendent in offering remarks to the audience. This will be, it really depends on who we're going to have in place. This is a huge change. It's because this superintendent has been in place for 20 years, and ever since she started, based on her own experience in working with young children in special education, she had a very good understanding on what was missing in Maryland at that time was a cohesive system, and over the last 10 years she was very much in the lead of building it, and that needs to be continued. However, on the plus side, I think we have a lot of things that are already in place, and I think a very stable and a robust system, as well as a good collaborative way of communicating with each other, and so I think that will help. I think this is a bit of a test as to how robust we are over the next year or so.
Great. Thank you, Rob. Sure. Other questions, comments, suggestions? No one is brave enough to do the star mute or star 6 and have their voice heard? Oh, great. I have a question, and I don't remember who did this. The website for MacArthur Network that was referenced?
Yes. I'm looking for that right now, and I will post that in 1 minute.
Okay, fabulous. Thank you, Heather. Other questions or comments?
I had to wait for it to unmute there, but this was an excellent presentation, set of presentations too, and the overall context that you set. Collaborations that are interagency across governmental sectors is very complicated, and it moves forward 5 steps and back 3, and then just keep moving forward. And I think that the whole point around the leadership is really critical. We have experienced that in California over a number of initiatives in the last 20 years that we call it the "and then they left" syndrome, and that is somebody who is really key and brings a lot of energy and has the proper level of responsibility at whatever agency they're representing. When they leave, you do have to recognize that you're going to have to regroup. But that's where the key parts around evidence of the infrastructure, so that it isn't so personality maybe driven, but it's critical to have that energy and commitment, that passion that gets you started, because people will follow that. So thank you very much for this. This is very interesting, and I will follow up on there were some points that I would like to follow up with individual presenters. So thank you very much. I appreciate it.
Great, thank you. And that was, I think those of us who have done worked in collaborative environments for a long time feel that pain when someone leaves. It really is hard, and it's hard to figure out how to bring that energy back. So we'll continue to kind of keep that on the list of things that we need to look at. What are some very specific strategies we can do to support shared leadership and collaborative leadership to deal with that. And again, our slides will be available on the Research Connections site, so we'll make sure that you all get that information so you know where to go to get those if you're not familiar with that. Other questions, comments?
This is Jessica. I just posted, but I wanted to tell everyone that I'm more than willing to talk to anybody who wants to follow up with me individually. I'm always willing to talk about collaboration.
And this is Heather Rouse. The same goes for me. If folks have any more questions, I did send both of those website links, one to the MacArthur Network and also one that has a little bit more information about kids, but you're more than welcome to reach out to me individually as well.
Great. And Sharmila, you will provide the contact information, is that correct for folks?
Contact information for the presenters, you mean?
Yes.
Yes. We can send out a message after the call to everybody that's registered.
Great. Fabulous. All right. Well, if we have no other questions, I'll turn it back over to our wonderful folks at Research Connections who can tell us where to go from here in a nice way.
Hello.
Yeah. Hello. Yeah, so we'll, as I mentioned, we'll go ahead and send out right after we get off the call a message with the contact information for all the presenters, and we'll send you the link for Research Connections. The slides, we'll try to get those up probably in a day or two. So check back on the site in a day or two to get the slides. Oh, David, could we also just send it in the email to everybody again?
Yeah, we can send it out right. We can send it out this afternoon.
Okay, so yeah. And then the webinar, as I mentioned, is being recorded, and it will be made available on Research Connections if you want to come back and listen again or share that link with others that you think might be interested. So thank you, everybody, for participating, and thank you to our presenters for doing such a fabulous job.
Thank you for having us.
Thank you, everyone.
All right.
Bye-bye.
Bye.